Wallach.
Hello, Carlos.
Hello, doctor.
Yes, sir. How can I help you?
I was in a truck accident, big rig accident, almost 3 years ago.
Okay.
Which came out with the results of multiple injuries. 2 herniated discs on my neck, 2 herniated discs on my lower back, torn shoulder. My knee is really bad, and my wrist, both of my wrists hurt really bad, like if it's arthritis in the middle of the night or in the morning. And at night, you can really sleep. Got to be waking up every little while because
Sure.
of...
what do you weigh, Carlos?
270.
270, okay. What I want you to do is we're going to do this by body weight, and this is going to rebuild the disc, the tendons, ligaments, cartilage, and bone of your wrist, your knee, your shoulder, your disc, and hips and knees and so on, okay? Neck. Here we go. I want you to take 2 scoops of the Beyond Tangerine NutriCrystals at breakfast, lunch, and dinner. That'll be 6 scoops a day. That's 3 canisters a month. It's 2 scoops and 8 ounces of water with breakfast, 2 scoops and 8 ounces of water with lunch, 2 scoops and 8 ounces of water with dinner. That gives you 130 nutrients. We're talking about vitamins, amino acids, things like minerals. I want you to take 3 ounces a day of the Osteo FX Plus, an ounce at breakfast, an ounce at lunch, an ounce at dinner. That's 3 quarts a month. That gives you 80 minerals and vitamins. It's focusing on the plant-derived colloidal minerals, 77 certified organic plant minerals, and 1,200 milligrams of the colloidal chelate liquid calcium per ounce. So that's going to give you 3,600 milligrams of calcium. It's going to give you 1,200 international units of vitamin D3. It's going to give you magnesium, manganese. It's going to give you sulfur, chondroitin sulfate, glucosamine sulfate. It's going to give you all kinds of neat stuff. Again, 3 quarts a month. Then I want you to take 20 of the glucogel capsules a day. That's going to take 3 240-count bottles per month. 3 240-count bottles a month of the glucogel. That'll be 5 at breakfast, 5 at lunch, 5 at dinner, and 5 at bedtime with a glass of water. These are the raw materials to support and promote maintenance and repair of cartilage, ligaments, tendons, connective tissue, disc between the vertebrae, bone matrix, and bone itself. Again, that'll be 3 240-count bottles per month. The EFAs, omega-3, 6s, and 9s, once you take 3 at breakfast, 3 at dinner, that'll be 180-count bottle per month. And then for immediate pain, discomfort, inflammation, swelling, and restricted range of motion, you can use our trauma oil from our Ancient Legacy division of our family of companies. You can apply the trauma oil, which is a blend of aromatherapy oils, to any place that hurts, your back, your elbows, your wrists, your fingers, your neck. And then after 10, 15 minutes after the oil soaks into the skin, you can use the CM cream topically on top of the trauma oil, and that's going to give you a double whammy. That you can use these things 4, 5, 6 times a day. They will not cause any negative side effects. And so you can use it when you wake up. You can use it 2 hours later, 4 hours later, I could say 3, 4, 5 times a day, and it will give you significant or total pain relief, inflammation relief, and these things do not cause any problem. They're safer to use if you're still driving the truck. This is going to kind of cover the neighborhood for you. You do want to avoid fried foods and margarines and cooking oils. You want to avoid processed meats with nitrates and nitrites. And I fully expect within, say, a month, you're going to see some dramatic benefit. And within 3 months, like I do with athletes, football players, which are your weight, so I'm used to dealing with people your weight, as football players, basketball players. I have a lot of experience with professional athletes, Olympic athletes. So these things will not cause you to fail any drug test or anything like that, whether it's a urine or blood test, no problems. And they will give you the best of raw materials, again, to support and promote maintenance and repair of cartilage, ligaments, tendons, connective tissue, disc between the vertebrae, bone matrix, and bone itself. And no carbonated drinks during meals, particularly, because they will neutralize stomach acid, which will reduce the efficiency of absorption of minerals, B12, and the digestion of protein. So it's imperative that you avoid the carbonated drinks, particularly during, again, meals. And please do call me every 2 weeks if you would, please, Carlos. Don't wait any longer than that. You're welcome to call every day if you wish to ask questions or give me some kind of feedback, negative or positive. We'll walk you through this. But this is your lucky day to call us.